My paper today, I will be speaking on OPT IVF software, a promising tool for controlled ovarian stimulation and triggering. So controlled ovarian stimulation is considered as one of the main factors to achieve a desirable outcome in the assisted reproductive technology cycles. FSH and LH play a synergistic role in folliculogenesis during stimulated cycles, and the protocol we all know needs to be tailored for each individual in order to maximize the prospects of success while minimizing the complications. Now, the aim of our controlled ovarian stimulation has always been to recruit a uniform cohort of follicles, to prevent the premature LH surge, to have good number and good quality of oocytes, to avoid ovarian hyperstimulation syndrome, minimal quantity of gonadotropins, good endometrial development, adequate embryos for vitrification, and cost and safety effectiveness. Now, this OPT IVF is a novel idea and a unique idea of correlating follicular growth in superovulation to particulate growth in crystallization, and that has proved promising. And this is a customized model for each patient for customized drug dosage and delivery evaluation. This is the software wherein this is slightly technical, but there is an optimizer for parameter estimation. There is a movement dynamic model, and which will then give us the optimized dosage for the patients. So what we have to do is, when the patient comes on day 1 or day 2 or day 3 of their cycle, we feed in the AMH values, the FSH values, and the age, and the software gives us the initial dosage. This initial dosage continues for the first 4 or 5 days, and when the patient comes again, we again measure the size of the follicles and put it into the software, after which there is no need for the patient to come again. The software will give us all the data as to what the dosage of the gonadotropin should be followed. On day 1, what we also have to do in addition to AMH, FSH and age is monitor or give the software the exact size of the follicles, say 2 millimeters, 4 millimeters, 7 millimeters, and we have to feed each and every size of the follicle into the software, based on which it will give us the data of the gonadotropin that is required. The initial starting dosage is low, and when we feed in the remaining data on day 5, that is again the sizes of the follicles, it will give us the remaining dosage in terms of how we need to follow it on day 6, day 7, day 8, day 9, 10. Also, when we need to give the trigger and when we should do the oocyte retrieval as well. So, if antagonist protocol is used, either you can provide the number of days you want to administer the cetrotide or ganirelix, or the program will calculate by itself. So that is at the user's discretion. So there are 2 or 3 things at the doctor's discretion. Number 1, the gonadotropin, whatever you want to use, whether you want to use REC, FSH, HMG, is again at the doctor's discretion. Number 2, the triggering agent, that is again at the doctor's discretion. It will just tell you the number of days, but not what molecule you have to use, and the day of starting the cetrotide as well. If you follow the software, it's good, but if you want to delay it by 1 or 2 days or sort of prepone it, then it's up to the user's discretion as well. So this is a study that we did in 4 categories of patients, that is less than 35 years of age, 35 to 39, 40 to 45. So we've done a study on total of 91 patients whose average age was 32 years, and the control was also a similar age group as well. And what we found was that the oocytes retrieved were almost similar, and the oocytes in the test group were in fact better, the number of oocytes. The number of M2 oocytes were also slightly better. The total number of embryos that we derived after using this software also was slightly better, and the grade A embryos were significantly better in the test group as compared to the control group. The pregnancy, if we look at the end product, that is the pregnancy rates, these are significantly higher in the test than in the control group. So the advantage of using this OPT IVF software or OPT IVF software is the number of visits that the patient makes to the IVF center reduces, because you just call the patient on day 1 or day 2, and then again on day 5 when you have to start the antagonist, and that is all. The dosage will decrease obviously, because the software also takes us down to a dosage of 112.5 or even sometimes 87.5, which is unheard of in today's day and age. The quality will improve and will have, there are more chances of getting normal embryo because we've also tested certain embryos by doing PGTA for the patients who opted for it. And it's great for new IVF specialists if there is any kind of confusion of when to start the antagonist and when to trigger or what should be the ideal dose for a patient. So it is customized or individualized ovarian stimulation, and this is the best way forward. Controlled ovarian stimulation in ART, as we all know, is an art, and Opt IVF can help you get the best outcome for your patients.
I can't reach the internet right now. Check your modem or router connection and try again.
Thank you for your patience.